Good morning. This is James Donnelly with Safe Haven Insurance, your Medicare and health insurance safe place. So it was a very interesting week. We were supposed to have a guest today. I would have loved to have Eileen Carini on here. She is the founder and president of Pulse. It is a family-centered patient advocacy resource. She started this organization 20 plus years ago due to a tragedy. I actually had the pleasure of meeting Eileen at a business group, and I fell in love with her and her cause. I went to one of her 2-day patient advocacy trainings because, of course, I work with people on Medicare and I deal with people for health insurance needs all day long. So I thought it would be a great resource, especially to have that in my tool belt. So I am now a certified patient advocate, so I could help families, walk through the process of medical care. I'm not an expert at it by any means. I definitely would lean on Eileen and her organization, but I was asked to be on the board. It is it's a nonprofit organization. So she's going to be coming on in the near future to talk about it. She had some things that came up she wasn't able to attend. So it was a very interesting week, everybody. I had the pleasure of being on the radio this week, not once, but twice. I met a gentleman through the NAIPC. His name is Tim Kennedy. He is a mortgage specialist. He specializes in mortgages for seniors and reverse mortgages. Now, there used to be like a taboo about reverse mortgages, but reverse mortgages have evolved and they're a great resource for seniors. I'm not going to get into the depths of it. It's not my specialty, but he's a great resource for seniors and the community. He volunteers with the NAIPC, so that's how we became friendly. So Friday, we recorded a show. His radio show is called It's Not Just a Mortgage. It airs Sundays at 8:30 a.m. on 1100 a.m. and 104.7 FM. It's a Long Island radio station, so you're not going to be able to hear it across the country, just locally. And then we record it again on Long Island Talk Radio, 103.9, and that airs Mondays at 3:30 p.m. Thank you, Tim, for having me on your show. I greatly appreciate it. You're an amazing resource for seniors. And he gave me the opportunity to talk about Medicare and what I do, because he saw such a value in what I do for seniors, because it is a very confusing and dauntless task to navigate the maze. So that was part of my week, and there's other things that are going on. I met with some really interesting clients, interesting situations. Again, every day is a reminder of why I do what I do. I had a gentleman call me and schedule an appointment. He is 65. He was 65 in March. He moved, and he didn't get any notification about enrolling in Medicare. He knew he had to, so he was a little concerned. So he reached out to me to help him. So we have an appointment set for Friday. I'm actually going to his home. He's unable to get to the office. So we're going to his home. We're going to help him enroll in Part A and Part B, and then weigh out his options for everything else. Now, another interesting story is you never know who you sit down with and who you meet. I had a client that found me on one of the Facebook moms groups. She came to see me in my office. Amazing woman. She's an anesthesiologist. She has a small practice. So she had to go on Medicare, because when you're self-employed, it doesn't count as group insurance. So she sat down with me. We enrolled her in Part A and Part B. She went on a Medicare supplement plan. We got her a drug plan. She got some dental and vision coverage also. But she was so happy with the way I explained everything to her and the way I walked her through the process and how patient I was with her and her questions, that the other day I was in my office. I was on the phone, and my office assistant, she knocked on my door and she said, "I'm sorry to bother you. We have an emergency. Somebody's on the phone. They said it's urgent that they speak to you." So it was this woman's boyfriend. So he has a small group. He's a business owner. He has a small group, 4 people on the payroll. And he called me and he said, James, I'm Debbie's boyfriend, and I have a problem. My broker dropped the ball and they canceled my group coverage. So now my little company has no health insurance. So what happened is, when you have a group insurance, you have to you get audited every year. You have to supply your tax returns, your NYS 45s. You have to prove hours for employees, et cetera, et cetera. 2 of the employees were on Medicare, so they needed waivers. It's pretty complicated. It's annoying. It's not really complicated. It's annoying. And some of these big insurance companies are real pains when it comes to audits. Almost like they don't want the business. They charge you these high premiums, and yet they don't want the business. They give you such a hard time regarding renewals and audits. So needless to say, the broker dropped the ball, didn't submit all the paperwork, and they canceled his group coverage as of April 1st. So he reached out to me, he said, please help me. I have no health insurance coverage for my employees. So we got on the phone right away, figured out what was going on. It was too late to get retroactive coverage from April 1st, so we had to submit a new application. But doing so, I kind of unveiled that it is a small group. There's 4 people on the group coverage. Only one of them had health insurance, so there was really almost no reason for him to be on group coverage. So after we submitted the application, I said, Barry, we have other options. We work with TPAs, we work with insurance companies. It makes no sense for you to have a group plan because of all the complicated stuff that we have to do every year with audits, things like that. So we work with a lot of health insurance plans through third-party administrators. So third-party administrators, what does that mean? So that means union plans, fraternal organization plans, association plans. So if you become a member of a union or an associate member of a union or a member of a fraternal organization or an association, we have access to their health insurance. And a lot of times, well, all the time, it's better than the marketplace. It's better than individual plans with high deductibles. And there are different plans available. There's higher deductible plans. There's no deductible plans. So we were able to get him in on one of those plans, and now the company pays the premium for the employee, and he was ecstatic. And a lot of times, these plans are less expensive than group coverage. So we were actually able to save him $500 a month, which equates to $6,000 a year. And he does not have to do that audit. Now, these plans are available for small groups, larger groups. It's a great resource. So if you're a business owner or an individual and you don't qualify for a marketplace plan, or you don't want to deal with an HMO plan, give me a call. I'd love to sit down with you, give you your options, and save you some money with a better health insurance plan. So that was one of my meetings this week. Well, 2 of my meetings really, and I sat with a friend of mine that I met in the business world. He's coming up on a Medicare age in September, so he wanted to sit down with me, him and his wife, and go over their options. So really, it was a Medicare meeting. We went over his options, explained to him what we had to do, when we had to do it. We could enroll in Medicare Part A and Part B 3 months prior to his birthday. I explained that to him. Also, uncovered some other things. I explained to him the difference between a Medicare supplement plan, a drug plan, a Medicare Advantage plan. He was very excited. We sat together for about an hour and a half. But through the initial fact-finding process, I discovered that him and his wife were small business owners. His wife had coverage through her business. It was just her and her husband who were on the plan. They were paying almost $2,700 a month for a family plan, and it was a high deductible plan, $6,000 deductible for the family, and max out of pocket was $16,000 a year. So it was a very, very expensive plan. and I discussed with them the options of these union plans, these fraternal plans, these association plans, these third-party administrative plans. And I was actually able to save them $500, seems to be the magic number, but they were paying $26.85 a month, and I was able to get them coverage for $21.35 a month. So $550 I was able to save them a month until he goes on Medicare, and then her plan drops down to $1,100. So I was able to save them a substantial amount of money, and then when she's eligible for Medicare, we'll get her on Medicare as well. So it was an interesting week. It was the health insurance week, believe it or not, and I was able to save people a lot of money. That's why I love what I do. Number one, educating my clients and saving them money. A lot of people just do what's easy, and and they just follow the status quo. But there's other alternatives that everybody doesn't know about. So these plans are available across the country, all 50 states. They're amazing. If you have health insurance questions and you don't qualify for a marketplace plan, or you don't want to pay retail on a marketplace for crappy insurance, high deductible HMO plans, give me a call. I'd love to help you out. So that was that. There's some interesting events going on this week, and I wanted to discuss something. I met a woman, Rosemary Clubfeld, I think. She's a Blue Star mom. Her daughter is a captain in the Army, and she's sad. She's in a lot of pain. She's proud of her daughter, but you worry about your children. I have 5 children, and I worry about all of them so differently, and I couldn't imagine worrying about one of my children overseas serving in the military. So she became active in a group called Blue Star Moms, and she became president of the Suffolk County chapter of Blue Star Moms. The website is, I'm going to look on my phone, it's a little, the website is bluestarmothers.org, bluestarmothersofamerica.org. She's hosting an event at Farmingdale College on April 27th. It's 10 to 2. All are welcomed. And what I didn't realize is, living on Long Island, that Suffolk County, New York, has the second highest population of veterans in the country. I couldn't believe it. That statistic blew my mind. And why she's so passionate about this organization is because our veterans come home after service, whether it's 4 years, 8 years, 12 years, 20 years, whatever the case may be, and they get thrown back into civilization. Now, for the amount of time that they served, they're told what to do. They're told, when to eat, when they could exercise, what to do, and they're trained to be warriors to protect this amazing country that we live in. And they're kind of thrown back into society, and they don't know how to assimilate. They don't know how to go back to civilization. And veteran suicide is at an all-time high. They said something like 40 veterans a day commit suicide. That's a sad statistic. So she is so passionate about this. She is hosting an event. It's a veterans conference to bring awareness to veteran suicide and to help the veterans assimilate. I know the police department's going to be there, and the unions, everybody's going to be there to help these veterans find their next step and help them. She's coming on our show on Monday, so I'm excited about that. I just wanted to tell you guys a little bit about that. She could be reached at president.ny6@bluestarmothers.us, and you can call her at 631-662-7576 for any information about this event. It's going to be at SUNY Farmingdale, April 27th, 10 to 2. All are welcomed. It's a free event, but you do have to register. She's expecting 200 there. There's already 160 registered attendees. So that's that. And then tonight we're actually honoring a good friend of mine at ACLD's Poker for a Purpose, another amazing organization. So ACLD stands for Adults and Children with Learning and Physical Disabilities. So they're homes that are for our disabled children and adults that can't care for themselves. It's a group setting. And a lot of times, these children and adults, they can't afford to go on vacation. Some families can, and they take their loved ones on vacation with them. And a lot of times, people are there, and it's funded by the state, and they can't afford to go on vacation. So this organization, Poker for a Purpose, ACLD, Poker for a Purpose, is to raise money to send everybody on vacation. It's amazing. It's an amazing event. So you guys could check it out. It's pokerforapurpose.org. It's a great thing, and they're honoring my friend David Gusson tonight. So that's going to be a great event. So every client that I speak to is unique. There is no cookie cutter client, and I know I say that often, but it's true. Every situation is different. I have one of my dear friends for 30 years reached out to me. His mother's was on original Medicare with a Medicare supplement plan, yet she's struggling financially. He totally forgot that I did Medicare, and he sat down with somebody else, and they put his mother in a Medicare Advantage plan. It's a great plan, Aetna Elite PPO, amazing plan. But we were talking about it, and I said, your mom is low income. A lot of seniors are low income, and they don't even realize it. They almost get used to struggling. It's just a strange scenario, but people get used to struggling. And our seniors, work their whole lives. A lot of them don't have pensions, don't have retirements, and they were banking on Social Security to fund their retirement, and there's not enough there. So his mom, I think, is making like less than $16,000 a year. I said, your mom qualifies for Medicare savings, for the Medicare savings program. And Medicare savings, there's different levels, but at that level, she's full-blown Medicare savings program. She would get her Part B back in her Social Security, if she would get all of her copays covered for drugs. And since she is on a Medicare Advantage plan, any of her co-payments on her Medicare Advantage plan are now covered through the Medicare Savings Program. So he was really excited about that. He had no idea that she was able to do that. Now, you could do this any time of the year, which is great. You don't have to do it during, AEP, which is annual election period, OEP, open enrollment period. You could do it any time of year. And once you get on a Medicare Savings Program, we could do a plan review and make sure that you're on the right plan. So just because you're struggling, don't be embarrassed. You can call me 631-608-1137 or reach me at info@safehaveninsuranceagency.com. Schedule an appointment. I'd love to meet with you in office, in your home, over the phone, and submit the application for the Medicare Savings Program for you. I do that for all of my clients that I feel are eligible for that. So that's just another unique situation. But I like talking about clients that I've sat with, clients that I've met, unique situations, and we're going to interview them, throughout my podcast, because I want you to hear it from my clients. I want you to hear it from people that I've helped and saved money. But this is a Medicare health insurance podcast, right? So we're going to pretty much go, and I have so much to say. There's so much to talk about. I could go on and on and on for hours and switch things up, but I want to start from the beginning, okay? So you're turning 65. You have to go on Medicare, or you think you have to go on Medicare. What do you do? What's your first step, okay? So before you turn 65, 64 and a half, give me a call, 631-608-1137, and we'll schedule an appointment. We'll go over your needs. We'll do a little fact-finding session, and we'll see where you're at, because maybe you don't have to go on Medicare. And one of the reasons why you wouldn't have to go on Medicare is you're still working full-time and you're on group coverage. Okay, now if your group is 19 or less, you may have to go on Medicare. May, not definitively have to, but may. If your group is 20 or more, you do not have to go on Medicare. So sit down with me and we'll figure it out. Now, if you are ready and you do have to go on Medicare, you have a window. That's your initial election period, okay? It's 3 months before your birthday. So if your birthday is in January, right? So you have the month of your birthday, January. You have 3 months prior to. So you have December, November, and October. And then you also have 3 months after your birthday, February, March, and April, to enroll without incurring a penalty. So sit down with me, we'll figure it out. I'll help you with the process, because if you're not on Social Security, you will have to do it on your own. Now you can go to Social Security, wait online, sit with them, they can enroll you, or you could sit down with me. I don't charge for that service, and I could get you enrolled in Part A and Part B seamlessly. Another thing that we would do is go over your options, okay? Why are there options? There are a few options. There's 2 different roads you can travel once you're on original Medicare. You could go Medicare Supplement Plan and Medicare Advantage Plan. Now, if you went Medicare Supplement Plan, you would need a drug plan. So let's talk about original Medicare. What is original Medicare? Okay, original Medicare is health coverage for anybody over 65 or 65 and over, anybody that is on long-term disability, permanent disability for 24 months. So that qualifies you for Medicare. So I have clients that are 20 years old, 27 years old, 32 years old that are on Medicare because they are permanently disabled. And another way to get on Medicare is if you have end-stage renal failure. So that means your kidneys are done, you have to live on dialysis, and that's another way for you to get on Medicare. So again, any age. But the most common age is 65 and up. So what is original Medicare? So there's 2 parts, the beginning of the alphabet, Part A and Part B. Part A is your hospitalization, okay? And 98% of the time, that is free. You've worked your whole life, but if you didn't, the minimum to qualify for free Part A is 40 quarters, okay? So that's 10 years. 40 quarters, 4 quarters a year, 10 years. So what is Part A? Part A is your hospitalization only. Like my friend Dallas does, he draws this box. It's your room and board in the hospital. So once you go into the hospital. So now everyone says, oh my God, my hospitalization is covered now. No, it's not. You have a Part A deductible, and you also have Part A copayments. So the Part A deductible is $1,600, okay? It's not $1,600 a year. It's $1,600 per stay per 60 days, okay? So if you went into the hospital in January, you got admitted, it's a $1,600 deductible. Now, if you went again in March, it's another $1,600 deductible. So what happens if that stay is longer than 60 days, okay? And let's be honest, they try to get you out of the hospital as quick as possible. I think 3 days is the average stay now in the hospital. I'm guessing at that, but I think it's 3 days. Now, let's say something catastrophic happens. God forbid. You have an accident, you're in the hospital for more than 60 days. You start to incur a $432 copayment per day while you're in the hospital. Now, let's say you're in a hospital even longer, okay? Now, anything over, it's 100 days, I believe, is $862 a day, up to days 150. And then after 150, you're on your own with coverage. You have no hospitalization. So it's scary. it really is a scary place to be. Yes, you're covered for your basic stuff. You have a $1,600 deductible for your stay, but that $1,600 again could now be $6,400. It could be $1,600 a day for up to 6 times, throughout the year. So it gets expensive. So $1,600 times 6 is $9,600 a year. That's a lot of money. Generally, I'm good with math, but I'm being recorded and I don't want to stutter. So $9,600 a year. If you went to the hospital 6 times, every 60 days. So that's pretty scary. So again, Part A is just your room and board. Now, Part B is your medical. So you're in the hospital, your doctor comes in. It actually covers drugs while you're in the hospital, X-rays, CAT scans, any procedures is your Part B. So Part B, again, is $174.70 per month, okay? If you're on Social Security, the government takes their money before you get yours. It comes right out of your Social Security. If you're still working and on Medicare, you have to pay that. You will get a quarterly bill, but you don't have to pay it quarterly. You could pay it monthly. We could set you up with auto pay. I could help you, walk through the process. It's pretty seamless. So what does Part B cover? Part B covers 80% of your medical costs, okay? 80%. So you go to the doctor, 80% of the Medicare allowable medical costs, okay? So there used to be a book, I'm sure it's online now, Medicare approved costs. So let's say you go to the doctor and you break your arm, Medicare allows $1,000. You will be on the hook for 20% of that. Medicare is going to pick up the tab for 80%. You're going to be on the hook for 20%. So you would have to pay, $200. But there is a Part B deductible also, $240 a year. So you're responsible for the $240 and then the 20% difference. But there's something else. Doctors are able to charge an excess charge, okay? It's a 15% excess charge. So let's say that broken arm is $1,000. Doctors are able to charge 15% more than that. They're allowed by Medicare to charge 15% more than that. So they can charge you $1,150. So Medicare would pick up the $800, you would be responsible for the $200 and the 15% excess charge. Now, I had a couple come to one of my seminars. I do Medicare 101 seminars every month, 3 times a month, in fact. They're free of charge. You can come. There's refreshments and food. I do them online every so often. So if you wanted to find out about it, you could reach out 631-608-1137 and find out when the next seminar is. Or we're updating our website, but it will be on our website also, our updated events. So now, how do you protect yourself? Oh, I'm bouncing all around. So I had a couple come to one of my seminars. Their son's mother-in-law was only on original Medicare and she had a drug plan. So she was, in essence, responsible for all of her deductibles, all of her co-payments, her 20%, and the 15% excess charge. She was getting up in age, and they said, you have to sit down with her, please, 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 and get her some protection. So we were able to. So a lot of seniors, old school seniors, think that they're okay with original Medicare. They're okay with the drug plan. That's like the bare minimum. That's the basics. My mother-in-law, in fact, thought that she was okay with original Medicare, and she didn't even have a drug plan when I first met her. Now she does, but she has a penalty. So there's ways to fill in those holes. It's Swiss cheese. Medicare, original Medicare is Swiss cheese. There's a lot of holes. There's a lot of leakage going on. So we need to plug all of those holes, and there's different avenues to do so. We could go Medicare supplement plan or Medicare Advantage plan. Everybody is unique, and in the next few episodes we're going to really dig in and talk about the difference between a Medicare supplement plan and a Medicare Advantage plan. Okay, so by being on Medicare, you have to have a drug plan. There are many different drug plans, depending on the area that you live in the country. And drug plans are different. Formularies are different, premiums are different. They're not all cookie cutter drug plans. I've sat down with clients who are paying $89 a month for a highly advertised drug plan, and their drug costs are thousands of dollars a year. When they sit down with me, I explain to them the difference. We get all their medication list. We put all their medications in, their dosage, the amount of times a day that they take the medication. I plug it in, and we're able to look at every drug plan that's available in the area for them. Drug plans are very unique. Just because you're paying a high premium doesn't mean you have to lowest the drug cost. There's drug plans that as low as $3.70 in this area, actually across the country, and some as much as $149 a month, $199 a month. I mean, it's absolutely ridiculous. But what I see is, depending on what medications you're on, it's almost as if the higher the drug plan premium is, the higher your drug costs are, and it's pretty silly. It doesn't make any sense. So I was able to save this woman who was paying $89 a month. They raised her premium. I got her on a $19.99 plan through Cigna, and her drug costs were actually, she believe it or not, she could have saved even more money and went on a $3.70 a month plan. But she was nervous, she was scared. She's like, it's too good to be true. I was paying $89.99 a month, and now I'm paying $3.70, and my drug cost is so low. It's too good to be true. I'm scared. I don't want to go on the cheapest plan. So we went on a $19.99 plan through Cigna, and her drug we actually saved her $2,000 a year in drug costs, and another $900 a year in premium. So it was interesting. Before you make any decisions with Medicare, sit down with an advisor. It doesn't have to be me. It could be any trusted Medicare advisor. Make sure they have good reviews. Make sure you know somebody who worked with them, because a lot of Medicare advisors push Medicare Advantage plans. They push Medicare supplement plans. Everybody has their own opinion and their own belief. At Safe Haven Insurance, we do a comprehensive approach. We work with Medicare supplements. We work with Medicare Advantage plans. We do what's right for our clients. And we decide with our clients what's best for them. We don't shove one thing down their throat or another based on our beliefs. How is that ethical? How is that fair? It's not. You can't say, oh, Medicare supplements are the best. They're the best for certain people. Medicare Advantage stink, it's managed care. Yeah, that's your opinion, okay? But everybody's situation is unique, and it's important to sit down with somebody who's going to do a comprehensive approach to Medicare planning and find what's best for you and your needs. If you have any questions and need help enrolling, you can give me a call, 631-608-1137. And you have our seniors or people that are already on Medicare that think they're okay. I would love to sit down with them and really make sure that they're okay and that they're not overpaying for their drugs or premiums. We do reviews annually. If you've never had a review, you can call me. We could do it mid-year. We may not be able to make a change. If you have to make one, we may have to wait for an election period. But this way here, I don't like that seniors make choices based on fear, okay, or lack of knowledge. I want to educate as many people about Medicare as I possibly can, because I want them to know, okay, that they are truly and wholeheartedly in the right plan, whether it's a drug plan, supplement, or Medicare Advantage plan, okay? And I have to say, I'm guilty of it. I really am. When I walk into Best Buy and I'm going to look at a TV or a dishwasher, what happens? A salesman comes over to me, okay? And they say, hey, can I help you today? What's the first thing that I say? Oh yeah, I'm not looking for a TV. I want you away from me. I don't want a salesman to talk to me. I don't. I'm okay. I say it too. Very often I do. But lately, I find myself saying, yeah, you know what? I'm looking for a TV, and this is what I'm looking for, and could you show me the best TV for my budget? Because I'm a little educated. I'm not a TV specialist. You know, the salesperson in BJ's is in Best Buy is the expert on electronics, not me. I have no idea. I have no idea. And I'm the expert on Medicare and health insurance. Don't be scared. It's not a salesy process. I really am wholeheartedly and genuinely here for you to educate you and give you knowledge. Whatever you decide, you want to stay where you are, that's fine. You want to switch, that's great. You don't like my hair, I don't like it either. My barber did a horrible job with my haircut. But if you don't like me, I could refer somebody else. There's so many Medicare advisors that I know and truly adore because they're great people. And I know that they have their client's best interest at heart. Give me a call, 631-608-1137. I'd love to sit down with you. I'd love to hear your story. If you have any interest on being on this podcast or asking questions, you could submit your questions to info@safehaveninsuranceagency.com, or you could call us, schedule to be on a show, or even be on the phone with us while we're recording. Okay, and if you have a business that you'd like me to talk about on the podcast, please give us a call, 631-608-1137. It was great chatting with everybody. Hopefully everybody got a lot of great information out of this. My name's James Donnelly. I'm with safehaveninsuranceagency.com, and we are your Medicare and health insurance experts. Looking forward to speaking to you next week. Bye for now.